Hi, how are you all doing? Guess you're all good. It's been a long time. I'm back and I missed you all. So today I want to talk about the clinical judgment measures. Thank you everyone. I got your emails. A lot of people reached out to me that I've not uploaded my videos in a long time. Yes, I'm back. I actually took up time to do some things and yes, I'm back. Thank you everyone. And how are you doing? Those of us that started the channel, have you written your exams? Have you passed? I told you all I was rooting for you and I was waiting for you to testify. It's not late. Please drop it in the comment section. I want to celebrate with you. Did you use some of the tips that I mentioned? Well, drop it in the comment section. So we all know that the Nclex Next Gen has started. So if you have written, some people are scared, and a lot of people are actually scared about the Nclex Next Gen, but I don't know why. Because this Nclex Next Gen is one of the best things that happened to nurses writing the Nclex exam, because the Next Gen exam, it's very much relatable in terms of clinical settings, because the questions. So that is why I want to talk about the clinical judgment measures today. Remember that they are going to give you case studies in your exams. So these case studies uses the clinical judgment model. Okay, so that is what I'm going to discuss in depth today. So stay tuned. If you've not subscribed, subscribe right now and turn on your notification bell, because I'm going to be making a lot of videos and I will try as much as I can to be consistent. Okay, so in the Nclex Next Gen, definitely they are going to be you'll be having the case studies as the case may be. Now there are rules for answering these case studies. As nurses, firstly, as nurses, we all know our nursing process. We have the assessment, the diagnosis, the our objectives, our nursing planning, implementation, and evaluation. My dear, that is the same model. Like that is when it is more. If you understand this foundation, it will be very easy for you to understand the case studies. So using our nursing process is number one. Then secondly, we have the clinical practice. If you've been practicing somewhere or you've been working as a tech in a hospital facility, I think it will be very much relatable. And also during your clinicals while you were in school, it will be very much relatable because they give you case studies. So in these case studies, you imagine as if you are handing over a patient. The patient you admitted in your shift, you did your nursing assessment, you did your nursing process. You carried out your nursing process on this patient, which involves assessment, objectives, diagnosis, planning, and all that. So if you did this, it will be easy when you are handing over this patient to the nurse that is taking over from you. I think it makes sense, because you are going to be telling the nurse, I admitted this patient has the diagnosis, this was the plan, this was our intervention. So if you understand the nursing process, I think we are closer to understanding this case study. Now I'm going to be looking at my notes so that I don't make mistake. I always give you the best and nothing but the best. So this is from my research and from clinical experience. Also, you can check out the NSCBN test plan to read more on the clinical judgment model. So firstly, we have recognizing the cues. When you talk about recognizing cues, this patient comes in with hyperthermia, temperature is 40 degrees centigrade, something like that, comes with severe dehydration. So these are the signs and symptoms that the patient comes in with. So you have to recognize these cues. That's number one, recognizing the cues. So you have to recognize this cue. Oh, this patient has hyperthermia. This patient is dehydrated. So with these, you know what these things are. Hyperthermia is increased temperature. So another scenario can be that the patient came in with difficulty in breathing. So you recognizing that cue is what I call the assessment in our nursing process. Do you understand? Because our assessment, this patient comes into the world with these signs and symptoms, was admitted. These are the signs and symptoms the patient presented with. So that is what happens in recognizing the cues. So that is number one. Then we'll now move. I hope it's clear. Do we get it? Then we will now move to the next one. Please, if you have any question, kindly leave it in the comment section. I will try as much as I can to respond. Also, do like and share the video. So from recognizing the cues, we'll move to the next one, which is analyzing the cues. Now this patient comes, this analyzing the cue, which is our analysis, more like our objectives in our nursing process. So this patient comes down with these signs and symptoms. You analyze the cue. What does this relate to? So as a nurse, when the patient comes in with some signs and symptoms, you can relate it. This patient is having respiratory distress. There is history of asthma. I can say, or this patient is usually allergic to pollen, and now this patient inhaled a lot of things, or inhaled dust, or inhaled a fall. You can say, oh, from your analysis, from the signs and symptoms, from the history, we have recognized the cues. That's our assessment. We took history. Now we are analyzing the cues. What could be the possible diagnosis of this particular condition? So that is what we are analyzing. You analyze the cues. So this will help you in the clinical judgment measures. The next is prioritizing the hypothesis. Now that we have given this diagnosis, you prioritize the hypothesis. In prioritizing the hypothesis, you are asking the patient. So the next one is prioritizing the hypothesis. Remember, we started with recognizing the cues, analyzing the cues. Then the next one is prioritizing the hypothesis. In the prioritizing the hypothesis, that is what is also equivalent to planning in the nursing process. So here you prioritize the hypothesis. What this means is that if the patient is having respiratory distress, you prioritize them. You take the one that is killing the patient immediately, like the one that is very life-threatening. You prioritize it for the patient and you start attending to them. Remember that example, if a patient is in respiratory distress, remember your ABC, airway, safety first. Safety, 1, 2, 3. Say it after me. Safety, 1, 2, 3. So remember airway, breathing, circulation. Okay, so airway first. So you ensure that your patient air is able to enter into the patient's body to ensure that the patient can breathe well. So that is where you prioritize your hypothesis. Be like, oh, this patient needs oxygen. So this will now lead us to the next one, which is to generate solutions. Okay, now you've discovered that this patient in the priority, airway first. So it will now lead you to generating the solution. This patient is needs oxygen, like is having airway breathing difficulty. The patient needs airway. So what you do to generate the solution is to discover that this patient needs oxygen. So our solution here is the oxygen for this patient that is having respiratory distress. Now this generating solution, these also come in hand with our implementation under our nursing process. Hope you are getting me. Hope you are not confused. Okay, started with recognizing the cues, which I explained. So analyze the cues, which I mentioned. Prioritize the hypothesis. Then you generate solutions for the hypothesis. It leads us further to take action. Now we've generated the solution. We say the patient needs oxygen. So taking action is carrying the oxygen and doing it for that patient, doing it for the patient, examining what you have done for the patient. Does it make sense? Is the patient getting better? Okay, so these taking actions, that is what you have done. So we've taken action, we've given the patient oxygen. Is our patient getting better? So these are the things that you look at for, which further leads you to evaluating the outcomes. Evaluating the outcomes also is evaluation in our standard nursing process. So you evaluate your nursing care. Okay, I recognize the cues, I analyze the cues, I prioritize my hypothesis. That's the diagnosis from the history I got. To prioritize the hypothesis, you generate the solutions. After generating the solutions, you've taken actions. That is your implementation. Now, is this patient getting better? Have your patient responded to your interventions? If yes, you go to the next diagnosis. If no, you start afresh again, because there might be something you did wrong at one point in time. I hope you understand it. Do you have any questions? Please leave them for me in the comment section, and I'll do well to respond to you. Do have a lovely time. Please, if you've watched up to this moment, kindly do like my videos, share and subscribe, and put on the notification bell for my next videos. Watch out for more content on how you can pass your Nclex, your NGN Nclex. Love you. Bye.